Hello, welcome to my channel. I'm Leah and I work in the hospital as a healthcare assistant or a assistant healthcare support worker, and a lot of people have asked me what it is like actually working in the hospital, what a HCA does and what has been my experience of it. And I've gotten so many DMs and messages and people asking just so much about it because it is unknown, and I guess now it's summer, there's a lot more people getting jobs. You know, as a HA you can work the bank, which is like part-time, so I thought this would be a good video to make just to tell people what it's like actually working in a hospital, you know, people coding and just helping people getting ready. So for me, I work in a cardiothoracic ward. Our ward is very intense, there's a lot of things going on at the time. So as a HCA, your main role is to help nurses and doctors. After the ward round, the doctors will see a patient and think, oh, they need the ECG. So they'll say you to do an ECG on the patient, and you know, you'll connect all of the leads on the right places and use the machine to do an ECG for them. Another clinical thing that we do is to help remove catheters. After surgery, when patients have catheters, they'll have them removed, so you know, you'll just deflate the balloon in it and pull it out. Another clinical thing that we do is tying chest drains, sutures with the nurse, you know, wearing sterile gloves and everything. They will cut the sutures and clamp them and then pull out the tubes in their chest that connect to a drain just to take out the fluid buildup in the body. So once they have stopped draining anything significant, it will be ordered for them to be taken out, and basically when the nurse has cut out all of the things, you will take the sutures and tie them for the patient really tight so that no air gets in. So that's really nice to do. And then another thing that we do is taking blood sugars, and you know, a lot of people are diabetic nowadays, so sometimes they need a sliding scale, like if they're on insulin, so it would be done every 2 hours, or if they are just diabetic, it'll be 3 times a day. If they have hypoglycemia, then you'll need to act on that quickly, like there's an emergency box underneath it. And yeah, so that is really the fun things that we do vitals. So this is something that's usually done by the nurses, as well, should be done by the nurses, but as healthcare assistants you can do that as well. So yesterday I did literally about 15 patients vitals at once. So yeah, we were a bit understaffed yesterday, but yeah, with the vitals you'll take their blood pressure, ask if they've had any pain, if they feel sick, which is like emesis. You'll put in their oxygen concentration, like if it's just normal air, it will be 21% oxygen. If they have a oxygen intervention, then that will have a different percentage of oxygen that they are receiving. You will put that into the screen. You'll count their respiration rate, which is how much they breathe in a minute, and you'll do their temperature in their ear, and you'll put the SATS probe on their finger to see the saturation. And then from all of that, there will be a NEWS 2 score. If any of those parameters are above 3, then there is a risk of sepsis. So, you know, if they have like a really high temperature, then the nurse will have to swab them and make cultures to see if they have an infection. Depending on how high their NEWS 2 score is, it might change from being 4 to 6 hourly to 2 hourly or 1 hourly, to have their observations and to have their vitals checked, and you know, putting on the blood pressure cuff in the right area and counting accurately. So there's a lot of that, which I quite enjoy doing. So those are the main things that are like the most interesting things as a healthcare assistant. And I am a band 2, which is, you know, the lowest, but then as a band 3 they can also do more things like take blood and, you know, venipuncture, which I think would be really nice to do. And as a band 2 you can be trained in doing it, but you won't get paid extra, but that's fine. If I go through the day of a healthcare assistant, you'll get there at 7 o'clock. Then you'll have the ward handover, which is where the nurses will talk about their patients and, you know, update you on, say, which surgery they've had, you know, their levels, and you know, the ward handover, which is quite long. It'll be like half an hour. You take notes on the patients, like how many people they need to mobilize, if they need a machine to mobilize, like a steady, which is like a large machine to help move them, and if they have any moisture lesions, which is like their skin breaking down from being wet or like sat on too long, whatever. And then all the HCAs will gather together and talk about any things that have happened, like say the daily weights, like X refused, Y needs this, and Z mentioned this, like I wasn't able to do this, can you do this? That will be the ward handover. So then the night staff will go home, and you'll start after hearing about all the patients, and then they'll go home. So then from like 7 we will change all the patients' beds and towels, anything that needs washing, and usually when we help them out of bed they'll need assistance out of bed, so it's good to have like 2 people, and we can help weigh them then once they're getting out of bed. So once they've had their beds changed, they'll have breakfast, and the night staff had done their blood sugars before that, so they'll have their fasting blood sugar. Once they've had their food, you will help everyone that needs help with their personal care, so you'll help them have a wash. And in my surgical ward, that includes anti-embolism stockings, unless they have a reason to not have them, like swollen legs, etc. You will measure the width of their calf and the length of their leg and fit them with stockings that will fit them. And when you're giving personal care to a patient, you'll try and help them to do as much as they can by themselves to keep them active and dignity and all of that. So you'll start from the head down and help them brush their teeth and give them mouthwash, help them comb their hair, and if they have a catheter, then you need to pay attention to that and clean the tube and help them with everything like that. Measure their legs every day and give them the right size stockings, because there's so many different sizes. And then you'll put on normal socks on top of that, and then they're all done. They've got a new gown and they're happy, feeling a lot better. So then that will take a while because there's a lot of people there, and sometimes they are able to get ready themselves, so you'll just give them all the stuff they need. And in the hospital they have octenisan, which is a body wash which sterilizes more, so you wet the skin and then lather it up for like a minute, and then it stays on there for a long time, and then it like properly sterilizes everything. So in hospitals there's a lot of risk of MRSA and all of that, which is really bad. And one thing I didn't realize before working in hospital is that a lot of people are actually infected with all of these infectious diseases like C. diff. So it's really important to help people stay clean, and always helping them have wipes before they eat, and scrubbing everything down. There's a different way that we prepare them if they are having surgery. So if they are having surgery that day, then you'll have to shave them in, say, like a cabbage surgery, coronary artery bypass graft. Then they'll need like lots of different areas in their body shaved, so that when they are having all of their incisions done, that there won't be any hair interfering with that. They have also some nasal gel that they put in their nose to clean it. Like everything in surgery is very sterile, so there's a lot of things that are clean for them, and they have to wear like paper pants and things like that, which are helping them stay sterile. So say they are having surgery, then you'll have to sort out all of their properties. That means putting all of their valuables in a safe, putting them in bags with barcodes on them for them, and putting their suitcases away, all labelled, signed off, etc. Like you even count how much money they have in their purse to the penny. And yeah, because it's quite sad when you hear them like transferring from a different hospital or whatever, and like one person was saying how the nurse is still his golden necklace. I was like, oh no, it's so bad. But yeah, it's really important to make sure all of their stuff is kept. Like all of their glasses will have a tag on them so they don't get lost. If they're having surgery, then they cannot eat. You know, as you know, they're nil by mouth, so you'll take away their water in case they accidentally drink it. And yeah, so that's to help with the anaesthetist and all of that. Yeah, so in the morning everyone will be helped washed, and then from that you'll have to put all of the laundry down the chute. So someone else will do the blood sugars before lunch. After lunch then we'll do the observations. So that is again doing like everyone's observation, their blood pressure and their NEWS2 score, and if it is low then their nurse will be, you know, making some form of intervention. And another thing with the catheters is every hour they need to be collected, especially with thoracic patients. They need to have a fluid balance chart, so that you can see if they're polyuric, if they're retaining fluid or anything like that. With cardiac surgery, you know, it's like your heart and blood pressure is really important. So if you have too much fluid or too little fluid, then that's a big issue. So yeah, we have to empty their catheters every hour and measure how much they're drinking. And sometimes they have fluid restrictions just so that the heart can heal and not be overloaded with fluid. Fluid can turn into tissue fluid, increases their blood pressure. Yeah, I always asking people like, like, how much have you had a drink? And like seeing how much of their cups they've had or their bottles. So yeah, throughout the day you're doing all of the clinical interventions, like, you know, tying drains, taking out catheters, whatever. And then after lunch you'll do the observations. So another thing I haven't really mentioned is about blood transfusions. These are really important. If a patient has low hemoglobin or something like that, then they'll need to have a blood transfusion. So there's a lot of potential errors with getting the wrong blood type. So it's really important to get the right one. So once the nurse will do all of the checks, they have the blood tested and etc. Then you will be the one to get the blood. So you go down to the theatres and collect the blood and take it back up. And when carrying blood, it can only be at a high temperature, like, not in the fridge, for half an hour. And if it is out of the fridge and not in the body, if it's not transfused within that half an hour, then that is a big issue and it will be thrown away. Each blood bag is like £120, so it's really important that there's no issues with the journey from the transfusion centre to the patient. And sometimes there's Jehovah's Witnesses who cannot receive any blood, and I was hearing a patient being really grateful how in her surgery the surgeon would have wanted to do a blood transfusion, but they ended up cutting her, giving her another incision to help the issue, so she didn't end up needing a transfusion. But sometimes in surgery they can go through many bags of blood, and even on TikTok I saw someone with sickle cell anemia. They do need a lot of bags of blood, so if you can, definitely donate blood, because it is being used every day by so many people. For the nurses to know if they need a blood transfusion or something like that, see their levels of lactate or potassium, sodium, they will do a venous blood gas. So they'll get some blood from a vein. You will have to keep it moving as you go to the venous blood gas machine, and then you'll put it in the thing that agitates it and then test it, and then it will print out a receipt of the levels in their blood. And sometimes it's really worrying because it's like significantly higher or lower than it should be, but then you just go to the nurse and give it to them, and then there'll be some interventions as well. There is a lot of walking around, lots of different places, lots of different wards, upstairs, downstairs, lifts, basement. Like my first few shifts I feel like I never sat down, and I've literally got like a toe infection from my shoes being bad, but just put a plaster on and keep going. Nowadays patients can have visitors, which is quite nice, because before they were feeling quite down, and yeah, so now they're allowed patient visitors wear full PPE, like a visor, a mask and gloves and a plastic apron, which to be honest, I personally feel that the government could do a bit more within a plastic little sheet, but that's another question. In terms of PPE, If a patient has an aerosol generating procedure, then that's when you wear the full PPE like an N95 mask. And at all times you have to be wearing a face shield or protective goggles with patients. Yeah, if they want to do a fast COVID test, they cost the hospital a lot, so they're only done in emergencies, though to be honest they are done quite a lot. So for that as well, you have to go far to collect it and then hand it to them again for it to be done. My friend was asking me some questions, and yeah, as a healthcare assistant you are definitely a porter, a cleaner, a like you do a lot of roles. You're part of the housekeeping, like you'll get them sandwiches and water, biscuits, make them tea, and everything to help the patients and the nurses. So yeah, after all of the day, then you'll have the afternoon and the night. So then you'll do their blood sugars before their dinner, and then they'll eat dinner, and then then the day is done. So that is the day shift. That was really long. I think I could probably do a different video about the night shift because it is quite different. Yeah, there's a lot of things that go on, and as a HCA, you're trained in CPR, and if they choke, and there's a lot of other things that can happen. So it's good to know the signs of stroke and seizures. Like even yesterday, I was just going to do the vitals for someone and they had a seizure. Yeah, it's like there's a lot of things that can go wrong and that do go wrong. You have to be very vigilant, and it's a very tiring job, very probably underpaid for the amount of work that you do. For me, I do like doing all of the work because as a doctor you'll be doing even more, and seeing all the ward rounds, all of that has been really valuable, and the patients are always so grateful for you in particular, and they remember your name and they're happy to see you when they do see you, cards, and they bring you chocolates and things like that, which is really nice. There's one gift from a patient that was infected with other things, and we weren't allowed to eat that, but apart from that, it's really nice to have the personal relationship with the patients and get their gratitude. And it's so great to see them like from their first day after the surgery from the intensive care unit, when they can't stand, they can't do a lot of things, and then a few days later they're feeling a lot better, their wounds, their surgical incisions have healed a lot, and they're doing great. So it's nice to see that. And like all the doctors, I've had a lot of people asking me if I'm a medical student, which is like maybe next year. It made me definitely de-glamorize medicine in terms of what doctors do. The doctors do a lot of admin, and they don't really take blood, they don't really do a lot of the things that you think that they would do. It kind of demystified a lot of things in medicine for me. And I've even seen some of the surgeries, like it's made me realise how much nurses do, like all the nurse consultants, the alert nurses. There's the hospital is basically run by the nurses and the HCAs who spend the most time with the patients and notice the most about them. One thing I haven't mentioned is with the patient's pain. So every hour you'll ask them if they're in pain and how much pain they're in out of 10, and if they're uncomfortable, if they need any help moving or anything like that. Sometimes with the older people, they don't like to ring the bell to inconvenience people, so it's definitely about checking people every hour, writing it down and being vigilant. So for me, I've really enjoyed being a healthcare assistant, and it has shown me so much about medicine and the NHS. It's been really good and I would recommend it. So if you have any more questions about it, then I can help you. And at the moment I'm doing 4 12-hour shifts. They're 12.5 hours, so it is very tiring, and especially with night shifts and changing your sleeping pattern has been a bit unpleasant, but I suppose you do get used to it. Patients really do need the 24 hours care, and you can't be caught slacking because it's people are relying on you. That has been what a HCA does throughout the day, and I hope it has been helpful. I hope that you get the job if you want to, apply and that you just know a bit more about what healthcare assistants do in the ward. So thanks for watching, and I'll see you in my next video. Bye!